Good evening, everyone. I noticed that each and every one of you posted relevant resources in relation to students with attention deficit hyperactivity disorder. Abigail, Megan, Nate, Adria, Rachel, and Sophie, they focused on characteristics of students with ADHD, whereas Lindsay and Christine, they addressed issues related to causes, and Delane, Brittany, Audrey, Taylor, and Ashley explored ways that will support students with ADHD in our classrooms. The website that Jennifer selected for this module addressed various issues that are relevant to students with ADHD and was very informative. As you have probably noticed from the readings for today's module and from your research on finding resources that are relevant to today's topic, IDEA does not define ADHD, and that is the reason why we use the definition that is put forth by the American Psychiatric Association. And this definition classifies ADHD as a neurodevelopmental disorder which is portrayed as a persistent pattern of inattention and or hyperactivity impulsivity that interferes with functioning or development. While describing characteristics of students with ADHD, some of the resources talked about the diagnosis of students with ADHD as well. And it is important to understand that this description, which is derived from the Diagnostic and Statistical Manual of Mental Disorders, or commonly referred to as DSM-5, also contains criteria that will assist professionals and mostly physicians in determining whether a child has ADHD or not. As indicated in your resources, a child with ADHD will display characteristics of inattention and hyperactivity or impulsivity, or it will display characteristics of inattention or hyperactivity impulsivity. The American Psychiatric Association definition recognizes three subtypes of ADHD based on the individual's unique profile of symptoms: predominantly inattentive type, predominantly hyperactive impulsive type, and combined type. Something that you might find interesting is that the majority of individuals with ADHD exhibit the combined type. For a student who displays characteristics of inattention, you might see the student fails to pay close attention to details, oftentimes makes careless mistakes, difficulty sustaining attention to tasks or while playing, does not seem to listen when directly spoken to, fails to complete tasks, difficulty organizing tasks or activities. Schoolwork is also oftentimes messy and disorganized. The student might avoid or resist situations requiring sustained attention, loses items necessary for task completion, easily distracted by extraneous stimuli, or oftentimes the student will be forgetful in daily activities. For the student who displays characteristics of hyperactivity, you might see them fidgeting or squirming, they cannot sit still, the inability to remain seated for a period of time, excess running or climbing, difficulty engaging in quiet leisure activities, talks excessively, and always on the go as if driven by a motor. For impulsivity, you will see the student blurting out answers. They have difficulty waiting in line or waiting for their turn, interrupting or intruding on others, interrupting their conversations, activities, and also act without thinking and being impatient. Megan's video indicated that these symptoms must be manifested in a child before age of 7. However, in the most recent changes, these characteristics are required to be present before the age of 12, and they should occur in 2 or more settings. So, for example, they should occur at home and school for at least 6 months. Children must present at least 6 symptoms from either the attention group or hyperactivity and impulsivity criteria, whereas those that are over age of 17, they must have evidence of 5 of these criteria instead of 6 of them. Looking back at the characteristics of students with ADHD, it is important to find strategies that are going to be very supportive for these students. And even though in your resources provided great tips and I think ideas about how to support these students, I would say that strategies that are proven to be effective for these students are self-regulation or monitoring strategies. Self-regulation is a behavioral self-control strategy which requires students to stop, think about what they are doing, compare their behavior to a criterion, record the results of their comparison, and receive reinforcement for their behavior if it meets the criterion. Self-regulatory strategies are used to modify common classroom behaviors such as working independently, staying on task, completing assignments, or remaining on their seat. Self-regulatory strategies teach students how to monitor their own behavior, how to engage in self-reinforcement, and also how to direct their own strategic learning. When implementing self-regulation strategies, researchers recommend the following steps. First, self-observation, looking at one's own behavior given a predetermined criteria. Second, self-assessment, deciding if the behavior has occurred through some form of self-questioning activity. Step 3, self-recording, recording the decision made during self-assessment on a private recording form. Step 4, self-determination of reinforcement, setting a criterion for success and selecting a reinforcer from a menu of reinforcers. And the last step is self-administration of reinforcement, which means that the student is going to administer a reinforcer to oneself. Something that you have to remember as teachers is that before you allow your students to implement these steps independently, you should teach them by first demonstrating the necessary steps through modeling or guided practice. In addition to suggestions provided from your resources in regard to accommodating students with ADHD in your classrooms, I want you to also think of using strategies that might be more like class-wide interventions because they are more time efficient and also manage students with ADHD without singling them out or stigmatizing them. They also have the advantage of benefiting all students, not just the student with ADHD. These class-wide interventions can have a positive effect on both academic and behavioral difficulties that are usually associated with ADHD. Some of these strategies might be behavioral strategies, so a contingency management. By positively stating rules, by having clear expectations and guidelines, and by identifying reinforcers and punishers, you might have all students in your classroom responding positively. Other ways to support your student might be by replacing their seat with a gym ball. And this might be maybe costly and also not practical for the whole class, but for these students, for students with ADHD, it is effective. Therapy balls have proven to improve in-seat behavior and also written work in regard to academic outcomes. Other ways to support these students might be self-monitoring, as I mentioned earlier, peer monitoring, class-wide peer tutoring. By pairing students together, it will give you a chance to monitor the whole class. It has proven to increase time on task and decrease disruptive behaviors, whereas academically, it has improved performance in math, reading, and spelling. Another area that you might want to focus on is computer-assisted instruction. Using computer programs to supplement instruction has been very effective. Just make sure that it is aligned with the curriculum. This increases time on task and also academically has been proven to increase math performance. In addition to educational and behavioral interventions, when talking about children with ADHD, you probably will notice that many of them will have also medication treatment. And many professionals believe that this is a great way to support students with ADHD. In my personal opinion, the use of medication should always be in conjunction with educational and behavioral interventions. And statistics show that about 80% of children with ADHD respond positively to medication. However, it is important to understand that about 30% of individuals who take medication do not see improvements in their behavior or academics. In addition, for those that have positive effects, there are also side effects such as loss of appetite, insomnia, drowsiness, tics, irritability, abdominal pain, headaches, and growth retardation. Fortunately, these side effects are most often very short in duration. In conclusion, I would say that as future teachers, you must pay attention to close collaboration between home and school if you really want to see positive outcomes in these students. Thank you for all your work on this module, and I look forward to your discussion on VoiceThread as well as tomorrow's module.